Amanda from Wisconsin. Greetings, Elizabeth from Connecticut. All right, we're going to start.
Recording in progress.
Before you make introductions, Jessica, I want to remind you that you can hear the presentation both in English and in Spanish. At the bottom of your screen, there's an icon that looks like a globe, and you click there. You can choose your language of preference. Likewise, at the top of your screen, there's an option that says View Option. So if you click there, you can choose your slides in English or in Spanish according to what you want to see. And with that, I pass it on to Jessica. Thank you so much for being with us today. Thank you, Marta. Good afternoon. Good morning. I know you're joining us from different places, so we welcome you to this seminar, this mental health and well-being for migrant farm workers and their families. And so we're going to be sharing tools with you all, and Patricia Ramarro is going to be presenting this seminar today. Can we go to the next slide? Our mission for Migrant Clinicians Networks is to create practical solutions at the intersection of vulnerability, migration, and health. Our vision is to attain a world based on health justice and equity where migration is never an impediment to well-being. Next slide, please. Migrant Clinicians Network. We have the opportunity to offer quality healthcare and other services for people that need continuous services, but that experience external forces that make them more vulnerable. On screen, you can see the ways how Migrant Clinician Networks offer support. So witness to witness is offer support and education for providers. Migrant Clinician Networks offer services to migrants, underserved migrants, and clinicians in healthcare provision for Migrant Clinician Networks. Healthcare providers are all the providers that offer healthcare, that doctors, community advocates, educators to health centers, the health departments in states and localities, so local and state health departments. The Witness to Witness program is led and was founded by Dr. Kira Wynne-Gardner, who is an associate clinical professor of psychology at the Harvard Medical School, where she was between 1981 and 2017. She founded and led the program in families, trauma and resilience at the Family Institute of Cambridge. She's also the author of this book in English called Common Shock. Next slide, please. So we're delighted to introduce our presenter today, Patricia Navarro. She's a licensed marriage and family therapist practicing in Long Beach, California, and has been a witness to witness associate since 2020. Patricia was born in Mexico and migrated to the US at the age of 12. She's fluent in both English and Spanish, and she has bilingual and bicultural capabilities. Given her Latino background, she finds it highly meaningful to assist the community in recognizing the value of mental health services. Patricia collaborates with families, adults, couples, and children, specializing in areas such as relationship conflicts, anger management, anxiety, mood disorders, multicultural concerns, parenting, premarital counseling, grief, and loss. Prior to embarking on her journey as a therapist, Patricia worked in the education sector as a school psychologist. So, welcome, Patricia. Thank you so much for being here. Thank you for such a beautiful introduction. I know, I think this is true. I believe it. Good morning, good afternoon, everyone, to everybody who's here in this presentation. I welcome you gladly. We're going to be together for at least an hour and a half. And I will ask for your patience because everything that we will discuss today is so important. And basically, it's a lot of statistics. We're talking about farm workers and seasonal migrant and seasonal farm workers. So we're going to introduce some ideas and practices that it's very important for us to pay attention and listen, pay attention to these ideas and practices because you can apply those to the people that you're working with, even for yourselves as well. That's why it's so important that we double listen, we do double listening to these ideas and practices. These ideas will help others and will help you as well. And these ideas will help me, and this practice will also help me. So this is so important, like I said, for us to pay close attention on this. The learning objectives are, first of all, to explain how the social or structural determinants contribute to enhance vulnerabilities and disparities in health outcomes among migrant, seasonal farming or agricultural workers. The second objective is to identify at least one depression screening tool. And the third one is to identify one factor that contributes to the risk of suicide among farmers in the rural areas of the United States. We want to achieve this at the end of our presentation. Who is at risk of mental health disorders? Many of us ask this, and if we think about this, you look to your left, to your right, you might find that, I mean, you're in your computers, but if we were in person in a room, possibly the person to your right or the person to your left could be at risk of having a mental health disorders, even ourselves. As I said, any of us. There's a study that says that half of the population, the worldwide, will develop some type of health disorder before they reach 75 years of age. And if we think of what happened with COVID, this risk, the anxiety and depression increased twofold. According to this collaborative research supported by World Health Organization and the World Mental Health Survey Initiative, researchers in 29 countries conducted 150,000 face-to-face interviews between 2001 and 2022 to arrive at this conclusion. Like I said, half of the world's population will develop a mental health disorders by age 75, sorry. What are the most prevalent disorders? According to this study, for males, the two most prevalent disorders were alcohol use disorder and major depressive disorder. And for females, the two most prevalent disorders were major depressive disorder and specific phobias. The majority of this disorder started early in life, by age 20, both for men and women. And again, after COVID, all this increased twofold, threefold, because we were isolated. Are some people more at risk than others, and why? Very important. Why? Well, because it depends on work-life conditions, and We're going to start with social and structural determinants of health. If we think about age, sex, constitutional factors, lifestyle and work factors, if there's unemployment, if there's no healthcare services, the work environment, education that we may have, food production, if we have a home or we don't have housing or not. All these are determinants that could cause now agricultural workers in the dairy industry. We're talking about 2.4 million people. Meat, chicken, and seafood processors, we're talking about 133,460 individuals. Although this percentage is difficult to estimate, about 3% of workers are likely to be between 14 and 17 years old. Workers born abroad represent 68% of the workforce. U.S. citizens make up 36% of the workforce. Legal permanent residents make up 19% of the workforce. About 15% of farm workers are migrants, meaning that they travel a significant distance from their home base to find work at one or more farms or agricultural employers. I feel very identified with this. I can relate to this because I was born in Mexico. My father was a farmer, and so he worked with grains because we lived in very hot lands. So he worked during several months, and in the summer, he had to go to another county so he could continue working as a farmer. This workers are more vulnerable given their life conditions. We're talking about low wages. The cultural and language differences are very important. Language itself, their immigration situation, if they're under illegal or citizens, their migratory lifestyle, the lack of access to healthcare. Many of them do not have health insurance or the money to see a doctor when they get sick. And where they live, the transportation difficulties, all of that. Some facts from farm worker justice, they say farm workers are one of the worst paid, and they cannot pay for the fruits and vegetables they harvest. So, and they are also victims of wage theft. They don't charge extra time. They are forbidden from unionizing. They don't have medical insurance. Many of them do not ask for health socials like Medicaid or food stamps because they're afraid of deportation or losing their jobs. These farm workers work between 10 and 12 hours a day, 6 days a week, under stifling heat without breaks. Most of these don't have documents to work or permits to work in this country, and they're very afraid, like I just said, to say anything about labor violations because they're afraid of being deported. Farm workers, communities generally deal with a high level of poverty. Few farm workers have employment benefits or access to unemployment benefits. According to data from 2019 and 2020, at least 20% of farm worker families earned incomes that place them below the poverty line. The average hourly wage was $13.59. Most farm workers do not receive benefits such as sick leave, paid vacation, or health insurance, or even and no retirement benefits whatsoever. Given this high level, or in spite of this high level of poverty, most of these farm workers don't receive any kind of public benefits because they're afraid of deportation, they're afraid of losing their jobs. So This is one of the very important things that many of these farm workers are still afraid to ask for any public support or benefit, even if they do qualify.
Something else is that women, my agricultural workers are has special vulnerability. They represent roughly 34% of the workforce, and they face particular obstacles in a male-dominated agricultural sector, including sexual harassment by the supervisors. Many of these women, they are also afraid of reporting as they prefer continue working, and that also generates anxiety. And it's important to keep in mind that that there is something needs to be done. The the being confronting uh, sexual violence make them also more vulnerable, and then it is very important to really be aware. In the last few decades, as we know, there has been increasing immigrants coming from Mexico and Guatemala from 2019 to 2020. 10% of the farm workers self-identified as indigenous. Many of the cultural and language barriers make these workers easy prey for unscrupulous employers. That's why indigenous farm workers often work in the most labor-intensive crops, but they are the ones that get lowest salaries. Many of them are undocumented and they are more likely to accept substandard working conditions, wages, and housing conditions uh, rather than risk retaliation by complaining. These conditions increase the risks of anxiety and depression due to the lack of access to appropriate language services and that make mental health referrals difficult. This is important. There are mental health services. Unfortunately, they aren't available in their language. There is a lack of mental health providers that can speak their native languages. Something else is the extreme heat that these workers place. They have 35 more times more likely to die due to heat-related causes than other workers. The heat can also have an impact on mental health. It might affect directly the brain functioning, as it has been shown in the rates. We know that heat disrupts the sleep patterns, which is also a risk factor for issues like depression and anxiety. And heat can also increase social isolation because if it's too hot, the people cancel their social engagements to stay safe. And additionally, the extreme heat is associated with increased suicide, which is not lessened by access to AC. And the other is the interpersonal violence also increases with the heat. This is something that we already know that during the summer there is more violence, more homicides, many more things happen because it increase with the heat. What can we do as providers? Well, it is very important that we can screen, refer, and offer easy and short tools, and so they can they so uh, they can address. So what are we talking about as screening? How can depression screening can be done? So we as clinicians, how can we know that the person is at risk of depression? These are the factors that affect and the agricultural workers. We can see if there is a history, the family history of depression. Maybe they are grief. Maybe they are unemployed. Maybe they have a the disability, they lack of social support, they are single, or they are going through a recent divorce. All those factors impact, and those are the things that you could know to determine if the person is at risk of having depression. There are many tools for screening, depression screening tools. One of them, the objective is that the healthcare professionals use the screening tools to identify who could be at risk of developing depression or who is already experiencing symptoms of depressions. That really enables to refer to a mental health evaluation. There are two questionnaires, the PHQ-9 and PHQ-2. PHQ is the self-administered report, so it is short and it is very convenient to assess the condition, the depression conditions. Both of those questionnaires assess the severity of depressive symptoms according to the criteria in the Diagnostic and Statistical Manual of Mental Disorder Fifth edition. The PH9 consists of 9 questions and PHQ2. This measure the frequency and the intensity of common depression symptoms. PH2 is only 2 questions. We are talking about the last 2 weeks, how often you have been bothered by any of the following problems. That we're asking if they have little interest or pleasures of doing things, and the other one is feeling down, depressed, or hopeless. It's very different. It's really important that we're talking about this needs to happen in the 2 weeks. Maybe one day you don't feel like doing anything. That doesn't mean that there is depression. We need to focus in 2 weeks that you are experiencing, or the people that you work with are experiencing these symptoms. It has to be for 2 weeks. The Beck Depression Inventory, that's also another self-assessment, and that also looks into the symptoms. It is much longer. It has a multiple choice questions that cover in various cognitive, emotional, and physical aspects of depression. Examples. So we're talking about I don't feel sad, and 0, I feel sad. 1, I am sad all the time and I can't snap out of it. That will be 2. Oh, I'm so sad and unhappy that I can't stand it. That will be 3. Once you complete this questionnaire, then you can tabulate the scores. It has to be over the 2 weeks. It has to be a symptom that lasts for 2 weeks or more. And here is the interpretation of the inventory. As I say, the highest, the size score, 1 to 10 is normal, and from 11 to 16, it's a mild mood disturbance. From 17 to 20, it's borderline clinical depression. 21 to 30, we're talking about moderate depression. 31 to 40, severe depressions. If you have a score over 40, it's extreme depression. It is very important when you are when you're looking into this is to see which level the person is, to to be able to refer them to the services of mental health services. Another tool is the CESD. It is also a tool that it is also self-administered. All of these are self-administered, and it has 20 items that assess anxiety and depression. This has to do, the question is about the last week. Do we have, I was bothered, but things usually don't bother me, and the same thing. You self-assess, then you score, and then you add up the scoring. There is the other one that is the Montgomery and Asper depression rating scale. This is a 9 questions, and this is when the depression has already been already diagnosed, and is to evaluate the this perception. It has to do with symptoms. It is that apparent sadness, reported sadness, reduced appetite, sleep, pessimistic thoughts, suicidal thoughts, inability to concentrate. All of those symptoms are related to depression symptoms. Now we're going to talk about a screen for anxiety. This is another questionnaire. It's called GAD-7. Remember, it asks about the last 2 weeks, how often you have been bothered by the following problems. 7 questions. Have you been nervous, anxious, or on the edge? And then you decide, no, not at all, several days. Again, we're going to adapt, and then we will measure how much anxiety do we have to determine whether you need to be referred to mental health services. The next one is the screening for PTSD. And according to the PTSD-5. Likewise, we do several questions, and according to the responses, we will determine if you have experienced abuse, earthquake, war, or somebody has been killed, or having a loved one die through a homicide or suicide. If the answer is no, then you stop. You don't need to continue. The next screening is for alcohol and drug use. According to the alcohol use disorders in the identification test, and where the unhealthy alcohol use is defined as the risk of hazardous consumption of or any alcohol use disorders. These are also these both could be administered or could be done by a clinician. And this can be done in less than 10 minutes. It is easy, in less than 8 minutes. And this tool assesses the drug use, not including alcohol or tobacco use. We have here the link. So if you want additional information on this. Screening for suicide. Some of us who don't want to even hear about this. Who is at risk for suicide? As we know, we're talking about the farmer workers, and the greatest risk are in the rural populations. They have a rate that it is higher than in urban populations. male workers that have that also have that are managers have also a higher rates of suicide. Uh, it it is it is 48%, 43 per 1,000 more than other occupations, 27 per 100,000. Even though most of the agriculture the workers are white, and the most of and the there are more people of color among these workers, and also women. The major factors contributing to risk, as we know, financial pressure is commonly associated to the stress of the workers and a poor mental health. The farm workers don't are reluctant to seek mental health care. Eh, This is due to the fear of stigma and discrimination, because they think that I'm crazy, or they will think that I'm crazy, and that's not true. It's just, if I have a problem, and then usually I speak to my partner, everything is at home. We don't go and seeking for mental health service, because that's something that it is not done. This is what we're trying to do, that it is so important to seek help for our mental health.
We also think that if we go, we're going to be discriminated against because we're not normal anymore. We won't be able to do the work as we used to, the job. And we're talking about that the suicide crisis in the US, it's a reflection of a much larger crisis that is happening around the world. An Australian farmer dies by suicide every 4 days. In the UK, one farmer a week takes his or her own life. And in France, one farmer dies by suicide every 2 days. We're talking about a worldwide situation, not just here in the US. It happens at the worldwide level, and it's important to pay attention and take measures to be able to help. What are the factors for this migrant seasonal farm workers? Well, we know the lack of work permits is one of the main factors. The pressures of earning low wages, a fear of deportation, poor working conditions, lack of health insurance. Many of them are working on the field. They get sick. We keep working. We don't go to the doctor because we don't have medical insurance or a way to pay for a doctor visit. Many is also limited access to mental health care. Many times we need mental health care services, and there are not enough therapists, or we simply don't believe in mental health care, mental health well-being. The vulnerabilities of farmers and migrant farm workers are interlinked. What does this mean? If we take a practical suicide screening tool, one of these is the QPR. What does this mean? Question, persuade, and refer. This is a way to find out if a person has suicidal thoughts, is planning to commit suicide. And we're going to talk a little bit about what QPR and CPR are, which is what we're talking about. Much of the world is familiar with the CPR acronym, which is short for cardiopulmonary resuscitation. It's a emergency medical intervention created in 1957. This process was designed to stabilize people who are in breathing or were breathing intermittently, who may be in cardiac arrest until the person can reach a hospital or receive some other form of health care. So there was a emergency medical intervention. Likewise, QPR, which is emergency mental health intervention uh, for suicidal persons. And it was created in 1995 by Paul Kennett. The intention is to identify people that have these kinds of thoughts and interrupt the crisis and refer the person to appropriate health care. Suicide resources. It's not only 911 now, we have 988. It's a hotline it's a national network of local crisis centers that provide free and confidential emotional support to people in suicidal crisis or emotional distress. They operate 24 hours a day, 7 days a week in all the country, in all the United States. They're committed to improving crisis services and advancing suicide prevention by empowering individuals, advancing professional best practices, and building awareness. Super important. Please write this number down, 988. If you know someone, you see someone that you determine is showing symptoms or suicidal symptoms or behaviors, this is a good number to share so they can find help. Now we're talking to adverse childhood experiences. We know, as they say in therapy, when we go see a therapist, let's go back to when we were young, when we were kids, what happened to us, to how to screen for ACEs, adverse childhood experiences. What are ACEs? These are adverse experiences in childhood, which are events or circumstances that could be traumatic to children during the first 18 years of life. Some examples are experiencing violence at home, abuse, neglect, or intimate partner violence. Sometimes we experience the violence amongst parents or the violence of parents toward the children, living with family members that have mental health problems or substance abuse problems. Instability in relationships, separation, divorce. Many times our parents were incarcerated, so we were separated from them. All those experiences bring events and things that as we grow old or grow up and we live, it has an impact on us. What are the categories of ACEs? And we know, of course, that when we're talking about these categories, we're talking about many conflicts at home during childhood. Like I said, exposure to substance abuse, maybe somebody uses drugs, or the siblings or the parents' mental health illness, maybe a mom, dad, or an aunt that lives with us and we're exposed to this mental illness. Exposure to violent treatment of mother or stepmothers. Many of us live with step-parents or with maybe our own parents, and we suffer with this violent treatment, and also criminal behavior in the household. Many of the abuse in children is like psychological abuse, physical abuse, and sexual assault or sexual abuse by contact. So it's really important to know all these categories and scoring to determine if a person is exhibiting these symptoms or falls within these ACE categories. How common are ACEs? When children experience an adverse event in childhood, their bodies can be flooded with stress hormones. It's very important to recognize when kids are going through these circumstances. It's as frequent. Lack of support can create long-lasting damage. That's why it's important to recognize what children have gone through, and when as an adult, think about what happened when we were children, when we were small, younger, and what of those behaviors or experiences, or how are they affecting us the way we live today? Somebody had a question. How are we doing? Okay, we're doing good. No, studies show a close relationship between the number of ACEs and ischemic heart disease. What is ischemic heart disease? You're talking about a disease, an illness brought on by atherosclerosis of the coronary arteries. In other words, we're talking about angina, heart angina. This can produce a heart attack. Another one is cancer, chronic bronchitis or emphysema, history of hepatitis, skeletal fractures, and poor self-rated health. The amount of adverse experiences in childhood were not supposed to have any significant relationship to diabetes or stroke, but it did. But there is a relationship to the other ones that I mentioned: cancer, bronchitis, angina, and poor self-rated health. Now we have this pyramid. What are we doing? We're kids and we suffer adverse experiences in childhood. Let's say we lived through abuse, physical abuse. How does this affect us? There's a social, emotional, and cognitive impairment. It makes us less able to socialize. We have emotional problems and cognitive problems as well. Next, we see the adoption of health risk behaviors. What happens after this? Many times we turn to alcohol or drugs. We hurt ourselves. After that, what comes next? This causes disease. We experience disability, and we can also face social problems. All of this kind of builds up one after the other until time comes and we have early death. That's why it's so important to be able to recognize and see from our childhood to where we are right now, so we can work on those situations. Many of these things are preventable, and we're talking about five of the 10 leading causes of death in the US are associated to ACEs. By preventing ACEs, we could prevent 21 million cases of adult depression, 1.9 million cases of heart disease. As we mentioned earlier, this causes heart attacks. So it's important to prevent it so we can help people live a lot better life. Live a lot better lives. Another thing that's important is addressing root causes of ACEs, such as racism, poverty, and community disruption, because by doing those, we can build equitable and resilient communities, which is what we're trying to do. When ACEs can be prevented by strengthening economic support to families, promoting social norms that create conditions where violence does not occur, and educating on domestic violence or any other type of violence, and ensuring a strong start for children and their caregivers. It's super important that we have these three things so we can prevent so many million cases of depression. A survey that we are looking at right now is the Benevolent Childhood Experience. It's questions, 10 questions, yes or no answers, and you can determine what their experiences were in childhood. Another thing is screening for the impact of COVID and or long COVID on a patient or a family member that they care for. This is another determinant. What happens in many rural counties had more non-English speaking households, and then some farm workers had significantly higher levels of mortality. Why? Well, because of what we've been discussing, they had no access to health services. They were afraid to ask for them. They were sick and continued to work. They had COVID and they did not know they had COVID. They thought it was bronchitis or a cold. So all of those things are determinants uh, for them to be also in a poor condition. So based on this, we know that those social determinants are also because of the poverty levels experienced by farmers. If we look at this slide, the pandemic disproportionately affected Black, Latinos, Native American children and families. We're looking at how the impact they had in the hospitalizations and deaths
during the pandemic. Now, we're talking about how many of the Native American children, one of 168, Black 310, Latino children 1 in 4, 1 for 12, and white 1 in 753. We can see here the difference in how children were affected according to where they are from. Also, living with grief. This is something that also impacts us. So we have to start to acknowledge that everything that affects us emotionally also impact us physically. Those are interconnected. Not being able to sleep, losing appetite, not having the energy, the dreams, that all that affects us and also causes depression. So everything that it is happening emotionally also has an impact, a physical impact. We will have headaches, backaches. All these emotions are also reflect physically. And we're talking about when this happens, we are dealing with the grief, a loss. It couldn't be just a loss of a person, but we could have lost our job or country. We migrated to another we were missing our country, or we have lost our job. Many emotions that we have, and all this reflects in our in our bodies. How can we help our patients or the people who we are working with? Well, one way is through referrals to mental health providers with medication, and then also non-pharmacologic suggestions. But it is important to know where can we refer them to. Double listening for you and the people you serve, and for yourself and the people you serve. And the three principal the principles that are exercise, sleep, and are also the recommendations and nutrition are also for ourselves and for them. It is very important to have a 7 to 9 hour sleep. Why? Because if you can't sleep if you can sleep 7 to 9 hours, you have a better concentration, you better decision making, your memory improves, you have a better way to handle stress, your immune system is better, and you have a better physical health. So it is really important for your uh, cognitive, physical, and mental well-being. If we don't sleep, or immune system goes down, we forget, we cannot make good decisions. The quality is as important as the quantity of sleep. And as I just mentioned, from 7 to 9 hours every day. And I'm telling you because I am also guilty. I don't sleep 9 hours, but I try to sleep at least 7 hours to be able to concentrate and to live in the best way possible. Uh, Also, very important is physical activity. This also help us that a person can also improve their brain health, manage weight, reduces the risk of diseases, and also improves one's ability to do everyday activities. The more active we are, the better we are emotionally, physically, and this is something that we need to do to improve our daily life. Another one is nutrition. Yes, we know there are many barriers, and that happens also to agricultural workers. And they work very hard, and often they lack a kitchen where they can prepare their food. Oftentimes, and the housing they are isolated, and they lack transportation, and that also limits a healthy food sources. And it's an irony that they harvest food that they might not be able to afford for themselves. We're talking about sleep, n- exercise, and nutrition. Those three elements are really important for our well-being. Another suggestion is also very practical. We mm, we will want to refer them to mental health services. Many of our patients have no access to those services by trained professionals. It is very important to mention that the services are usually not available during the time, their hours. We need to make sure that the person can attend their therapies when it's not working, and that's one of the obstacles because the working schedules of our patients were the schedules of the work schedules of our patients. Also, there are also wait times for these services are very long. And then some do not want it. How can we support these services? The first, if we start with a small change, so we can go forward, even a small change makes a big difference. Therefore, making a small change is worth the effort. Sometimes we only need one person to onboard ourselves. That makes a big difference. sometimes it doesn't have to be a professional worker. Sometimes we sometimes we're just going through a difficult time and we just need someone to talk to really vent, and it's not just trying to give us a solution, but just to be listened. It's really important having someone who can listen without judging. I, it, ta- it, grounded techniques when you have anxiety. One of the recommendations is to observe the room, and your senses. If you are in a room, look around and objects, sounds, colors, smells, and also the temperature. All these things, when you are feeling them, distract you from your anxiety and make your anxiety lower. Another thing that you can do is you can ask what date is, what is the year, how old you are. You want to ground yourself, and you drink some water. Use breathing techniques are very important. Uh, Move so you can change the environment. Oftentimes we just focus on the anxiety, and we disconnect from everything else around us. So it is really important. Write them down, these techniques, and I imagine that you will get the slides. So you can also write them down and you can also share them with others. Quick ways to feel better right away. Set a small goal and plan for it. It is very important. What are you going to do the next day? A small goal is how you get big changes. It has to be something that it is reasonable, small. Oftentimes, if I don't know what I will be doing, if I don't have a presentation, if I don't write it down, then my mind is wandering. But if I set in my calendar my to-do things, then I'm planning and then I focus better and I feel that I'm doing productive and that I'm being productive. Very important. Write two things that you're grateful for. You can do it in the morning or in the evening before going to bed. Journal. Eh, Write how did you feel today during the day? What did you like? What did you didn't like? It's very, very important. Uh, Pay attention to something beautiful. Sometimes we go through life without looking what it is around us because we're focused on where we need to go to that we're going to where we need to go. So it is really important to notice what it is around us. Take a nap. If you're tired, take a nap. There is nothing wrong, and you don't need to feel guilty if you're taking care of yourself. Give or receive or get a hug really helps. It's beautiful. It feels nice if you give it or you receive it. We're also talking about the laughter, how important it is. This is a video. Maybe you can share it with your patients, but this is something that you can take home. Do something that really makes you feel well during the day. Either writing, painting, reading, taking a nap. Don't feel guilty because you deserve it. Can we ask a question, Patty? Sure. We have a question. First, a comment. The agricultural workers do undertake a physical activity when they are working. Do you suggest that we recommend to exercise after work or in the free time? That depends on the person. We know, yes, their work is physical when they are working. They are walking, they are hauling. That is physical. If they think that that's enough, nobody's telling them that it is not enough. If they need to do weightlifting or another exercise, they can do it. Instead of doing more physical activity, another thing is meditation. That really helps the brain and also emotionally. Sometimes we think that we need to do everything physical, but remember that our emotional health is also important. If they if they already if their work is physical the whole day, now I'm going to focus uh, on the emotional the depending on what the person wants to do. If the person wants to do weight lifting or something like that, then that's fine. Does it make sense? Yes. Yeah, you're sharing different options, and one person can choose 2 or 3 things that make them feel better, and they don't have to do everything. So they don't need to do so much extra work. So you're giving us different options. Thank you. Another question or comment? No, that was the question. And then there was another question, but it was also answered in the slides. Ahora, now we're talking about the breathe. How can we lower or anxiety through breathing? This is an exercise that you can inhale and exhale when you are experiencing the symptom, the anxiety symptom. It is here. We're not going to do it because it takes 5 minutes, but I wanted just to that we have this type of intervention so you can feel less anxious, and then you can clear your mind if you are overwhelmed, if you have many anxiety symptoms and you feel that you can't work, that you can't think clearly. This exercise will help you uh, to lower the anxiety symptoms. So this is something that you will be getting.
So you're going to get this after the presentation. Now, gratitude and health, expressing gratitude. There's a lot of research that says that people that express gratitude are less depressive. And why? Because they're happier. They don't have as much stress. And like we're saying, gratitude and health improve sleep. People that show gratitude tend to exercise. And if they take medication, they'll take it. They have an optimistic outlook. They have hope. They're much more positive and they live much more positively. The benefits that we're discussing, it's wonderful. Why? Because when one expresses gratitude, one tends to be happier. tend to want people around us to be happy as well. Another thing that gratitude does is that it reduces substance abuse when you are okay with yourself, when you do everything, all the good things to express and feel the gratitude in yourself. There's no reason to abuse substances, drugs. Um, you're also are active, right? You have goals, you are healthy, and this reduces inflammation in the body, suicidal thought. Your blood pressure is normal, and you can control your stress, depression, and anxiety. That's why research says that in the last 20 years has shown that when people express gratitude on a daily basis, it elevates their sense of well-being. Something else that we can do and start doing is grab a notebook or something and write down two things that we're grateful for, both in the morning and in the afternoon when you have the time. It doesn't have to be right now, but when you have 5, 10 minutes to say, look, I'm grateful today, I'm grateful for this and that. It's very important to express gratitude. That makes a huge difference in us. And if we express it, people around us will get that same enthusiasm. Practicing self-compassion. Many times we feel guilty because yeah, I'm gonna get my nails done, I'm gonna get a haircut, I'm gonna go to get a massage, I'm gonna go for a walk, I'm gonna go to the beach, because we're always thinking about the others instead of thinking of us first or ourselves first. We need to learn to love ourselves, make us ourselves our number one priority, because this can also cause a lot of issues in our everyday life. So it's important not to feel guilty for wanting to take care of yourself. Remember that when we love ourselves, we try to be as best as possible so we can give the best of us to others. So remember that self-compassion is like become your own best friend. Many of us are our worst critics or our own worst enemies. It's so important for us to be able to have compassion for ourselves, to take care of ourselves, love us, pamper us, say, I'm my best friend. I love myself. I am happy and feel comfortable with myself. That is practicing self-compassion, and that helps both us and those who live with us. So what does self-compassion show? We know reduces depression, anxiety, and shame, increases happiness and life satisfaction, reduces social comparison. We have the tendency to always compare each other to this person, this other person, our co-worker, our neighbor. We need to learn to accept ourselves just the way we are. It reduces caregiver burden. What happens when we're taking care of someone that has some sort of disability, or maybe it's our parents who are getting older? If we love ourselves, we can improve the way we take care of people that we are in charge of. We have better physical health and a better physical immune function. I don't know how much we know about this, but when we're under a lot of stress, our immune system crashes or goes down. What happens when our immune system is not working? Any virus can attack us, any disease can attack us. We get depressed, we get anxiety. All of this has an impact on us physically and emotionally. And completely. And that's why when we talk about exercising, nutrition, meditate, do yoga, doing any kind of activity that we like, that makes us feel better, that makes our immune system strengthen or go up, and defend us from viruses or diseases that don't bring us any good. Another thing about self-compassion shows that one has better sleep quality. Remember that sleep is gold, like they say. Something else that is really good, I don't know if you heard about this, but petting a dog helps with anxiety symptoms. So just a few minutes of petting a dog, stress hormones decrease and oxytocin increases. That makes your anxiety diminish. Something else that you can do besides just petting a dog is to write, breathe, go outside for a little bit, get some fresh air, some sun. All of that helps a lot. Move around a little bit. All of that helps a lot. And walking in nature, looking at mountains, or we're close to the beach, walking along the beach. All of this is very beneficial physically and mentally. And it helps to reduce stress. Why? Because you are giving your brain oxygen, your brain is calm, and that allows you to make better decisions. And your brain is not filling you with stress with all the things you have to do. Why? Because you're walking, you're meditating, you are focusing on yourself at that moment, and you're feeling what you're doing. This is really important, like to be mindful, to make sure that to know where you are at the moment, not where you were yesterday or where you're going to be tomorrow, but focus on today, on this moment. And yes, it might be difficult. It's not easy because we all need to make changes in our lives, in our routines, if we want to improve our health, mental and physical health, emotionally as well. We need to make some changes. And like I said, we start with small changes, not big, unattainable changes, because that's the problem. We have goals that we don't meet, and that will stress us even more. So it's important to recognize that there are things that we can do, but in small increments. Like I said, admire the beauty of dawn, of dusk, or the sun setting. When we go to the park, when we go to the beach, those are things that are really important, that bring many positive things to our bodies and to our minds. Resources. We have several resources here that you're going to receive. How to control anger. These are ideas to help ourselves. We're going to prioritize, make our set priorities in our lives. We need to take care of ourselves. How to be empathetic to other people without judging. I mean, there's so many resources that you're going to receive at the end of this presentation, and that I hope that you can adapt and implement and you and share with the people with whom you work. Here we have several links for suicide prevention. So suicide prevention resources. Remember, one is the 988, the National Suicide Prevention Lifeline, crisis text line. You're going to get all of this. So anybody you think that might be going through suicidal symptoms or ideations, these are resources you can have at hand. For like at any given moment you realize somebody's going through this, you can share. We have some other resources of crisis services. What can you do? Where can you text? Remember, these are open 24 hours a week, 24 hours a day, 7 days a week. What they're trying to do is to hear people and guide people and give them a better service so you can get stable, you can stabilize and change the attitude. These are resources for migrant seasonal farmer workers. We're talking about Farm Aid Hotline. Depending on you of when it's happening, you can get informed and have access to this. 3 exercises saying of gratitude. We talked about gratitude, what are the benefits of gratitude, how it helps us to have a more positive outlook, and how that helps to make people around us a little more positive as well. So if you go to this link, you can download this is a positive psychology. So these are 3 exercises of gratitude exercise that health professionals can use with patients. Download it, make copies, and start using it. Using with your patients. So this is the end of our presentation. I hope you liked it. I hope you learned some of the things that for me, I'm learning something new all the time. It's very important also to take things that from this presentation that will help me and my patients and the people that I work with, that this might be useful for them. The most important thing is to determine when a person is going through a difficult moment and what we can do to help them pull out of those difficult moments, and what are the resources available and where can we refer them to. Thank you again. If there's any questions, any comments, please, right now is the moment to share them. Jessica and Marta, how are we doing with time? We're doing fine with time. If you have any questions, please raise your hand and I can unmute you so you can ask your questions. I'm going to exit this sharing.
Wait a couple minutes. Questions, comments, anything. This is the time before we finish. And as I said before, as I said in the chat, later on I will be sending you an email with all the links for the evaluation, all the tools that were mentioned. I will be sending your way later today. And what are you seeing in the screen? If you please answer the survey. It's in English and Spanish in the chat. It's also the link. It is very important for us that you answer the survey. It's very short. How many questions do you have in the survey? I think about 4 or 5. So based on your responses, this is a way how we can do this workshop. We can continue having these workshops for you, and we can know if we're doing well or not, on how can we improve, and also suggestions about other topics that we should be bringing to the community. That's why it is very important that you answer. We have a question from Rosa Miranda. I can unmute you. You can ask yourself the question. Hello, Rosa. Can you hear me? Yes. My question was if you have worked with a specific program where they have enabled or a program